Okay, right. Well, good afternoon, everyone. This is about the getting going ahead. Stuart, are you going to lead off on this one? Okay.
Yes, absolutely. So good afternoon, everybody. As Councillor Furr has said, this is the report around the Getting Going Again Fund, and the report seeks approval from the elected lead member for Adult Services and Public Health to launch the Getting Going Again grant, and for authority to award grants to be delegated to the Director of Adults Health and Care in consultation with the executive member. The total grant scheme is £950,000 and will be funded in its entirety via the Ministry of Housing, Community and Local Government grants that has been provided to the council for the council's work to support clinically extremely vulnerable people during the pandemic. So clinically extremely vulnerable people are particularly at risk of poor outcomes from COVID-19, and this is as a result of illness, disability, medical treatment and other factors. And for many of our CEV residents, in fact, some 83,000, they have been shielding for large parts of the last 15 months, and some or many will benefit from support to get back to a more normal way of life, and the idea is this grant will support that. So just by way of context then, so since March 2020, Hampshire County Council has worked really successfully with district, borough and city council partners, as well as the voluntary sector and the NHS, to support people who have been identified as clinically extremely vulnerable or clinically vulnerable to COVID-19. And this has included the establishment of the Hampshire Coronavirus Helpline, making offers of support to all of our 83,000 residents who have been identified as clinically extremely vulnerable, as well as delivering essential supplies to over 8,000 residents since March 2020. So we want to build on this successful partnership, and the Getting Going Again grant will help by using these established relationships to be able to support innovative projects which will support, as I said, CVs and CVs to get going again as we move on, hopefully through the roadmap and reductions of national restrictions. In terms of the fund itself, so applications will be actively asked for from the voluntary sector, as well as all tiers of local councils in Hampshire. And we are proposing that to ensure that all parts of Hampshire are reached, that there is an equitable distribution, and that's outlined in table 20 of the report, which shows the number of CVs and the consequent number that will be allocated to each district. We will be encouraging joint bids across localities where voluntary sector, particularly organisations, are delivering across more than one district. The application to the scheme will need to satisfy the criteria set out in point 13, and money would need to be allocated before the 31st of March 2022. In light of the significant amount of money, so £950,000, in light of the amount of money available and the necessity, of course, to start programmes at pace, given that we are rapidly and hopefully continuously moving to less restrictions, it is proposed that authority to award is delegated to the Director of Adult Health and Care in consultation with the Executive Lead Member for Adult Services and Public Health. The grants themselves will be used to provide positive interventions for CVs and their families, and also the communities that support them to get back to normality, and in particular to address health inequalities. Some of the schemes will offer services such as supporting with confidence building by offering buddying opportunities for people who are going out for the first, second, third or even fourth time, a listening ear to support people who may be feeling worried or anxious, an enhanced mental wellbeing support delivered through some of our established partnerships, and also the development of physical activity projects that might support health and wellbeing more generally. And we're aiming these grants at local organisations so that they can create projects that meet the specific needs of the communities that they serve. Just into the finance then. So the finance is, as I said, is wholly funded through a grant that has been provided to the council by the Ministry of Housing, Community and Local Government. It's 950k, and the total value of that grant is £4 million. So it's a proportion of that grant. In order to monitor the performance, a named lead liaison officer will monitor the success and spend of the programmes that the grant will fund, and they will report to a joint group of colleagues from across the VCSE and the public sector. So we'll have a good eye on the success and the impact of the grants in the project. So in line with the Equality Act, an equality impact assessment has been completed for this project and can be found at page 10 of the report. The council does not hold specific data on the protected characteristics of clinically extremely vulnerable people. However, it does know that some of the conditions that would mean someone is a CEV are more prevalent in older people and those from a BAME background. For example, sickle cell disease or diabetes. In addition, specific disabilities are identified as making someone clinically extremely vulnerable, for example, Down syndrome. So the projects funded through the Getting Going Again grant would need to meet the needs of clinically extremely vulnerable, and therefore it is considered that the programme will have a positive impact on some people who may have protected characteristics. And the communication and the requests for applications for the grant will also highlight the need to reach people who are underrepresented in our communities. Just a small note on climate. So the County Council, as you know, has committed to a target of being carbon neutral by 2050 and resilient to the impacts of a 2 degrees C temperature rise in the same time period. To support this aim, there's 2 decision-making tools that are used to assess all programmes that the council are involved in. We have run the grant programme through both of those tools, and as it is fundamentally a funding distribution programme, we haven't identified any positive or negative impacts of the grant programme itself, but of course individual projects will require individual assessment at a local level. So that's the kind of overall summary, and in conclusion, the Getting Going Again Fund grant will provide positive interventions to some of those most disadvantaged by the COVID-19 pandemic as we move forward through the next few months and beyond. So very happy to take any questions.
Thank you, Stuart. I mean, this is a really good news story and it's a good use of public money. Have you spoken to the districts and the CVs about this coming their way? And have you had any indication of their eagerness or willingness to take part?
Yeah. So yes, we have. So the concept of this grant has been discussed and devised with our welfare recovery group, which is a joint group with the districts and VCSE. So they're very, very aware of it. And people are very keen and already thinking of ideas of how they may be able to use the money, including making sure that they're coordinating over geography so that we're not duplicating, but we're also taking advantage of the ability of working over a kind of wider area. So yes, there is interest in that.
No, well, that's good. Especially, I'm really like the working over areas, so there's no duplication, and nobody's trying to do better. You know, they're just working together. That's good. Councillor Carpenter.
Thank you very much. This is really good news again, this grant. I just wondered, you were talking about districts and whether they will know about it and how. I just wondered whether the availability will be advertised widely to smaller organisations in the community, more local organisations who may well know of the people that might need this. I'm sure that there are groups all around our county that would benefit from this and are already helping people. So that's my first question. What's the availability of how it would be advertised, really? The second question I was going to ask, I just wondered if there's also been any research done locally or nationally on the nervousness issue of people to get back to normal, from this, from the less severe, just being nervous and going out again and doing things, to agoraphobia. I was just wondering if there's been any research done into whether COVID has had an effect on those kind of things. But I know it's slightly aside from the grant, but they may need to put money into those sorts of interventions.
Yeah, so thank you very much, Councillor Carpenter, for the question. So to your first point, we will use all of our networks to advertise this grant. In fact, I was speaking to someone today who chairs one of the leadership forums for the Volunteers Community Secretary as well around this. So they're primed and ready, and we'll obviously do communications and there'll be a press release, and we'll advertise it as far as wide as possible, including through our district council partners, who of course have those more local relationships. So that's absolutely the intention. In terms of the in terms of the research question, I haven't seen any detailed research to date with any specific research into people who are shielding and what their kind of anxieties are in a kind of academic way. What we do know though is that the CVs who have been supported over the last 15 months or so by our voluntary sector partners, there are many of those who are still being supported and are still very anxious and are needing lots and lots of additional support to kind of get going again. So we do know there's definitely a need out there, and our insights team are doing lots and lots of different pieces of work to understand the impact of COVID. And I think in time we'll get more and more of a picture of that long-term impact. But we know at an individual level, certain people are requiring support.
Thank you.
Graham, did you want to come in then?
Yeah, thank you. I just wanted to say a few things, but just to follow up, I think on some of Stuart's comments to Councillor Carpenter's question. I think at this point there's an awful lot of anecdote, and similarly, I've not seen any academic findings in terms of anxiety for those that have been shielding. But what I would say is across our communities, not only those that were advised to shield, and of course the shielding advice for different groups within society tended to take place at slightly different times. So for example, younger people with learning disabilities, some of whom were advised to shield early on, others weren't advised until much later on, until we got onto the third national lockdown. So it's impacted differently. And clearly for some people that may not be clinically extremely vulnerable, there is a high degree, quite understandably, I would suggest, of nervousness about being out and about. So despite a categorization, if you like, of being CEV, we know across our communities there will be high levels of anxiety in terms of people going out and about and undertaking their normal business, going to the supermarket, picking up medications and so on and so forth. So, and I think to some degree we will see over a coming period, and the coming period will be months, if not years, and I think in some cases it will be years, the consequence of what we've seen since the 23rd of March last year. And I did just want to say that we are seeing some significant consequences of the first lockdown being imposed from the 23rd of March 2020. That's the first thing across the county of Hampshire. It's in excess of those numbers within the report of 83,000 clinically extremely vulnerable people that we've needed to extend support to over the period. The second thing I wanted to say, and this cannot be overstated or underestimated, just in terms of what we have seen, the phenomenal support across our own services within the Department of Adults Health and Care across the County Council, but moreover working with partners at every tier of local government, so district and borough, town and parish, and of course the magnificent voluntary community sector. It's absolutely shone, and I think one of the things, and this fills me with a sense of pride, is that through this grant we continue to do the work that we've been doing over the last 15 months now, which is vitally important as we go forward. So my final comment is I really welcome this report and the commitment of £950,000 of funding for the Getting Going Again fund. I think it's both vitally important, but also a really important signal in terms of what we and partners are doing to support our communities. Thank you.
Thank you. Councillor Withers, do you have any questions? Or
I was just very interested in what Graham was talking about there, and obviously the people that have been isolating, because it certainly during the election campaigning, it was very clear on a lot of properties on the estates that had big A4 sheets there saying, please don't knock on the door. And obviously, that is going to have a considerable impact on getting them back into society, as well as the long-term casualties of COVID-19. But I'm also concerned when you look at the daily news about another lockdown, the effect it would have on the NHS staff and the primary care staff. So would you see some of these grants being available to also go to those two areas to ensure that those that are suffering complete sort of lockdown as a result of COVID-19 get their fair sort of share of support.
So in terms of how we've operated, and the clinically extremely vulnerable list was drawn from primary care and indeed consultant patient lists. So the slight strange thing, and I made this point on a meeting earlier today with regional colleagues, the interesting thing about the work that we and partners have done in supporting the community of clinically extremely vulnerable people is that very, very small numbers of the 83,000 people whose names appeared on the lists that were provided to us were previously known to us as customers of social care services. They were primarily obtained through primary care registers, so people with life-limiting medical conditions, and indeed people undergoing active consultant treatment, whether that be for cancers or other life-limiting conditions. So this is a continuation of that support that we've provided to effectively people under the care of the NHS in its various forms.
Yeah, I think the point I was trying to make, Graham, is that I understand that process, but the fallout of COVID-19 effects on staff is really the issue I'm looking at, both within the NHS and within our care homes, that they are identified as well.
Yeah, no, sorry, my misunderstanding, my apologies. There is a huge amount of support that is being provided across the care and indeed the NHS sector. So, for example, across Hampshire, Southern Health are taking the primary lead in terms of welfare, including mental health for staff. There was the report published earlier this week in terms of fatigue and burnout being a potential risk for NHS and social care staff. We're also very attentive to that. So we've done a huge amount of work. We're continuing to do a huge amount of work with the wider social care sector through Hampshire Care Association, who are the main representative body. We've been making sure that government grant funding in terms of that staff welfare, and also the ability for staff to be able to self-isolate should they need to without fear of loss of income, is something that we've been absolutely supporting and promulgating across the sector. And we continue through Hampshire County Council's good offices to make sure that there is very active support around mental health and well-being for all staff. So it is a primary concern. We wouldn't be specifically, unless members of staff were CEV, looking to support through this funding stream. But just to underline, there is a huge wealth of support, and we take those responsibilities very seriously and are very proactive in it.
Thank you.
Can I just say, just following on from what Graham said, and I know it's very antidote and you know, it's just word of mouth, but I have 2 or 3 clinically vulnerable people in my neighbourhood. Yeah. And all 3 of them have made a point of phoning me and saying how wonderful the service from Hampshire has been. Their phone calls, the service, they said they couldn't have asked for more, and constantly praised our hotline and that for the help when they needed it. They were so impressed. So, you know, well done to the teams, really.
Yeah.
Yeah. Councillor Tunstall? Do you want to ask any questions?
No, I'm all right, thank you.
Okay, fine.
Thank you.
Right. Okay, Stuart, I'm very happy to approve this. Oh, I'll tell you what, Dave, can I just ask you, if the money isn't all spent, and I jolly well hope it is, but if some of, does it go back into the 4 million pot for COVID relief, or does it have to go back to the government?
At this stage, this is a specific grant for purposes of CV, and the purposes that Stuart is using for reporting and proposals here are very much in line with that grant. Our expectation is that we will fully spend all of the grant, because a large proportion of this amount actually is carried forward from last year. So the expectation at the moment is that it will all be spent. Obviously, it won't go back to, it's not part of a general grant that will go back corporately. It may be one of those issues where MHCOG ask how much we have spent and we may have to return any unspent, but that wouldn't be until 31st of March 2022, in which case we should be making every effort to ensure that it is spent on those people that need those services.
Thank you. Good. Okay. Right. Very happy then, Stuart, to go to the recommendations. Right. Recommendations 2 and 3, very happy with them. So thank you all very much. Okay. And everyone have a nice weekend.
Thank you.
Hope the weather stays good.